Welcome to PT Microlessons, fast lessons with big impact. This lesson will provide an overview of cardiovascular disease as a continuum rather than as separate conditions. We'll begin with the earliest vascular changes that occur in the arteries, follow how those changes can lead to coronary artery disease and acute coronary syndromes, and then examine how damage to the heart muscle can ultimately progress to cardiomyopathy and heart failure. Understanding this cascade helps explain why early prevention and intervention are so important. First, let's look at how many cardiovascular conditions are connected. Rather than occurring in isolation, many cardiovascular diseases develop as part of a progression or cascade. It often begins with cardiovascular risk factors that damage the vascular endothelium, leading to atherosclerosis. As plaque develops and narrows the coronary arteries, coronary artery disease can occur. If a plaque ruptures and suddenly blocks blood flow, it can result in an acute coronary syndrome, such as unstable angina or a myocardial infarction. Over time, repeated ischemia or myocardial injury can damage the heart muscle, leading to cardiomyopathy. As the heart becomes less able to pump or fill effectively, heart failure may develop. Throughout this lesson, we'll follow this cascade to understand how these conditions are related and why early recognition and intervention are so important. Before we discuss endothelial dysfunction and atherosclerosis, let's briefly review the major cardiovascular risk factors. Some, such as age and family history, are non-modifiable. However, many others, including cigarette smoking, physical inactivity, excess body mass, hypertension, dyslipidemia, and diabetes or prediabetes, can be improved through lifestyle changes and appropriate medical management. Although these risk factors affect the cardiovascular system in different ways, they all share a common outcome. They damage the vascular endothelium. This endothelial injury initiates atherosclerosis and marks the beginning of the cardiovascular disease cascade we'll discuss next. Now that we've reviewed the major cardiovascular risk factors, let's examine how they initiate the disease process. The first step in the cardiovascular disease cascade is endothelial dysfunction, which ultimately leads to atherosclerosis. The endothelium is a thin layer of cells lining the inside of every blood vessel. In a healthy state, it maintains vascular homeostasis by regulating vascular tone, preventing unnecessary clotting, reducing inflammation, and controlling the movement of substances across the vessel wall. Over time, cardiovascular risk factors such as hypertension, smoking, diabetes, and dyslipidemia injure the endothelium. This injury triggers a chronic inflammatory response, allowing LDL cholesterol and inflammatory cells to enter the vessel wall. As lipids accumulate, fatty streaks and eventually atherosclerotic plaques develop. As these plaques enlarge, the arterial lumen progressively narrows, reducing blood flow to downstream tissues. In the coronary arteries, this limits oxygen delivery to the myocardium and sets the stage for coronary artery disease and potentially acute coronary syndromes if a plaque becomes unstable or ruptures. As atherosclerotic plaque enlarges, the coronary arteries gradually narrow, reducing blood flow to the myocardium. During periods of increased oxygen demand, this reduced blood flow can result in myocardial ischemia, often presenting as stable angina. However, if a plaque becomes unstable and ruptures, a thrombus can rapidly form and partially or completely occlude the artery. This leads to acute coronary syndrome, which includes unstable angina and myocardial infarction. The longer the myocardium is deprived of oxygen, the greater the amount of irreversible myocardial injury. Over time, repeated ischemia or myocardial infarction can weaken the heart muscle and contribute to the development of cardiomyopathy. Next, let's look at cardiomyopathy. Cardiomyopathy refers to diseases of the myocardium, or heart muscle, that impair the heart's ability to pump blood effectively. Cardiomyopathies can result from numerous causes, including coronary artery disease, prior myocardial infarctions, genetic disorders, hypertension, valvular disease, or infections. The major types include dilated, hypertrophic, and restrictive cardiomyopathies, each affecting the heart differently. Some primarily impair the heart's ability to contract during systole, while others impair the heart's ability to relax and fill during diastole. Regardless of the underlying cause or type, cardiomyopathy progressively reduces cardiac function and increases the risk of developing heart failure. Now, let's wrap up with heart failure. As we discussed, cardiomyopathy may impair the heart's ability to contract during systole or fill during diastole. Regardless of the underlying mechanism, when this dysfunction becomes severe enough to impair the heart's ability to meet the body's demands, the result is heart failure. In other words, cardiomyopathy is one of the major causes of heart failure, but heart failure itself is the clinical syndrome that develops when the heart can no longer pump or fill effectively. Heart failure is a clinical syndrome in which the heart is unable to pump enough blood to meet the body's metabolic demands, or can only do so at the expense of elevated filling pressures. As a result, stroke volume is reduced, leading to decreased exercise tolerance and impaired tissue perfusion. Patients commonly experience symptoms such as dyspnea, fatigue, and exercise intolerance, making heart failure one of the most important cardiovascular conditions encountered in physical therapy. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.